I guess, the course of the weekend, I did get down to Ramia, and I was in Burgeo and down the coast yesterday in Bernals and Rose Blanche. And, one of the things that, is coming up everywhere is just, I guess, the state of our province fiscally. I mean, people are worried, and people are wondering, when's the budget coming? And I try to explain, look, it's going to be delayed. And you talk about our reliance on oil. And people are expecting, actually I was talking to the Mayor of Rose Blanche yesterday, and, people are expecting some tough times when that budget comes. And it sort of struck me funny because an issue that I've brought up before, I'm going to bring up now. I know that the Minister of Health, Mr. Kent, has been on Twitter quite a bit, basically tweeting about some of the stuff that needs to be done in health, whether it's sick leave for employees and stuff. But one of the things that they're not talking about much, and really they haven't done much on, is a place called the Newfoundland and Labrador Centre for Health Information. And I know that's a topic that's come up on your show before, but this is a group, basically it's a government agency really, where the Auditor General has pointed out for years now that there's been huge pay raises, a severe lack of job competition within the centre, and it's costing taxpayers tens of millions of dollars. So I know that the Minister of Health said, and previous Ministers of Health said, we got to look at this and we got to take care of it. But I still haven't seen any action. And so that's what I'm putting out there today is I'd like to get some kind of response on, has this government, again, they're out talking about the thing. And again, you hear the rumblings within the health boards. I mean, I'm talking to people in Western Health and Eastern Health. Everybody's very scared for loss of services and loss of positions. We see it coming. So at the same time we're hearing about that, we're not hearing anything about the Centre for Health Information, which is also spending tens of millions of taxpayers' dollars, and the Auditor General says they're not doing it right. So what's going on? That's what I'd like to know.
Well, I think we'd all like to know, and pending cuts in healthcare are going to always be not very well received, certainly when added to the pile that has been some really terrible stories and tragic stories in the last couple of days. And of course, those are, infrequent, thankfully, but they do pile up. So I don't know where the cuts are going to be found in this particular budget, nor do I know how much we're going to borrow. But I guess even when we speak with you and Mr. Ball about the potential to find efficiencies, to spend less money and not jeopardize outcomes. That's where I think the conversation is going to have to go. If there's going to be cuts this year to stem the tide, waiting for the price of commodities to rebound, that's only going to be short-term solutions. But when, in fact, we cannot suffer a forever ballooning healthcare budget with the, as people put it, the gray tsunami coming and the aging demographic, just stemming the tide with certain budget cuts is not going to make a row of beans difference. We got to find about how we're going to actually find whatever efficiencies may indeed be available so the spending cannot jeopardize outcomes. I don't know where we're going on this front, Andrew. Maybe we'll find out more when the Red Book comes, but that's the key conversation to me.
Well, it is. And again, one of it comes down to, and actually I think the story that you're referencing was one that was on VOCM about, and again, I haven't talked to anybody on it, I just read the report about the basically the tragedy where somebody showed up to health sciences and basically passed away in transit, really. And I've gotten emails on that, and they're saying, where's the accountability? And that's what it comes down to, is accountability. So this is just one instance where, again, when we're talking about the Center for Health Information spends on average $20 million. If they're not following the rules, if they're not following protocol, and that's costing us money, that comes down to accountability, is coming down to the minister making sure, and the premier making sure that the right steps are taken. They've known about this and been in power. Again, this was brought up in 2011. This is one of the things, one case of where you can exercise accountability. The other step, again, and you're talking about, I think it's the long-term solutions that have to come. Again, our budget is ballooning, and I've had a round table with professionals 2 summers ago, and everybody there said at the same time, look, it's not about more money, it's about smarter spending. It's about more communication, about more collaboration. They all said it. Yeah. And I think everybody identified ways that they can, again, the professionals and the advocates can come together and make sure that people like myself, who, I'm a lay person, really, when you think about it, I'm a legislator and a policymaker. I have to listen to the experts. But I think we need to take some steps now that really we're going to see long-term improvement. And one of the big ones we have talked about, and Dwight has talked about, is when it comes to diabetes. in this province. And that's one step where if we make some changes now and look more at the prevention rather than what the concentration right now seems to be on dialysis. And again, you only have to ask anybody who's dealt with dialysis how good it is. But if you talk to the professionals, they'll say, look, dialysis is an admission of failure. That's when we've already gotten too far. What are we doing to combat the front end? And right now that's making us the most prevalent province in Canada.
But isn't that, awareness and education inside that stuff? I know you talk about having a diabetes registry and those types of things, and there are important steps taken inside healthcare. But things like diabetes, I mean, if you talk about prevention, isn't it just the onus on individuals to take care of their own health in some regard? Because this is not all about what government spending can do when it comes to either access to treatment, wait times, ongoing treatments. This is really telling people that the healthcare problems you may indeed be suffering, some of that's because of what you put in your own body. So is that what we do on diabetes? Because I don't know what government's role would be outside of that.
Well, I'll tell you one place where government's role is there, and I agree. There is a personal responsibility on all of us to improve our eating habits. But it's just come out recently, there was a story actually about what we pay, especially in rural areas, for fresh fruit and groceries. It's astounding and amazing. I look out here, the food gets off here with Marine Atlantic. It goes across the province to St. John's and gets dropped off and distributed. We get what comes back on the back end. So again, people do have a responsibility, but when you can't afford to get the good food that you need for your children, it makes things extremely difficult.
Now, that's a tricky piece of business for government, isn't it? Because that brings in two distinct, different approaches. It would be fat taxes and or subsidizing what people would consider to be healthy.
Well,
so in some respects...
That's not the angle.
Okay,
that's not the angle I was going to go at. One of the big angles was when it comes down to one of the big parts of the cost is the cost of getting the food here.
Yeah.
It's the actual transit cost. And I agree, look, it's not a simple fix. It's not easy. But one of the things, again, it's costing us huge amounts to get that produce, that product here in this province, and that's on Marine Atlantic. This government has not made a single call to Marine Atlantic to discuss their rates.
How do you know that?
Believe me, I've talked to people within Marine Atlantic. They haven't called. I've asked them myself. Have you heard from anybody in the provincial government to discuss this? It hasn't happened. It hasn't happened. The province needs to lobby the federal government. Again, we've been lobbying them on a number of other issues. One of the issues that we have not lobbied them, I can guarantee that I have not seen a single bit of, documentation or information or press release where we talk about what we can do with the federal government to help deal with the Marine Atlantic costs, which, again, are leading to increases in the cost of food and produce into this province. And again, which is causing some of the issues that we have here is just the lack of access to healthy foods.
Well, you would hope that maybe our 7 members of Parliament, Liberal members, would be the ones leading that charge, because I know what the provincial government does about Marine Atlantic with zero control. And with the cost of transportation, even if you say that the truck should go to Burgeo before it goes to St. John's, and then the transportation... I just don't know where those things lie. And if that lobby effort can make an appreciable difference, then I say pick up the phone, let's start lobbying. But, I also think it's fair to point out that we've got nothing but Liberal members of Parliament who might speak to it, but nothing's happened. Not a damn thing. The fuel surcharge still in place. The cost of the ticket and transportation continues to blow up every single year. So once again, we'll see who has what kind of cards up their sleeve to deal with it. But I'm not sure where the answers lie. But they're all important suggestions. I'm not disputing it. I just don't know what the PC or Liberal provincial governments will be able to do on the Marine Atlantic front. You have to remember what we're dealing with. Okay.
You speak out about it because a lack of commentary in any way seems to imply that it's not an issue. If you don't talk about it, then apparently it's not an issue. And again, we've gone and talked to the federal government on a number of issues that are under federal jurisdiction, and we have to work with them on it. And again, I agree with you. Our MPs have a role to play, and I can guarantee you I've had a number of conversations with all of them about, look, this is a huge issue for this province, and they are up there doing what they can. I'd love to see a change in the federal government, to be honest with you. I think that might hopefully lead to something there. But and again, that's my bit of plugging right there. But what I would say is, look, this province, this government all of us, we have a role to play. Even if it's federal jurisdiction, we can still speak out about it and try to work towards solutions. We had to do that. That is our job. Why do we have a Department of Intergovernmental Affairs?
Yeah, and I don't know what calls have been made. I really have no earthly idea on that front, and it's an interesting question that should be posed. One last healthcare issue before we move on. An interesting story that was part of the news cycle this week is also about the lack of in vitro services here in this province. We're talking about our population. We talk about immigration. We know the birth rates in this province are way down. Consequently, we have this aging demographic, which I think is our number one problem. How do you approach this type of service being introduced? Because this is absolutely straight up cost. But it is troubling for some 600 families who have tried to avail of the service, have to go to the mainland beyond their initial consultation. What's your thoughts on the in vitro offering, the lack thereof in this province?
Well, it is an issue in this province, and it actually is having a direct impact on the cost of our budget. Now, I'll give you an example. Again, many people have to travel to Halifax. I've had friends. I've had personal friends that have had to do this. And again, I won't get into the technical side of it because I'm probably not the best one to talk about it. We've got some great people in this province, doctors that are doing that. But when they go over there and they go through their cycles, a lot of times the cost is so prohibitive that you get a number of implantations. And what's happening, again, you see a lot of people having, twins and or triplets. And in some cases, there's health issues associated with this. A lot of these, again, I had a friend that spent a month in the Janeway because of this. That's the cost on our system. Whereas if the service was here in the province, it may lead to people, obviously, a lower cost to these individuals to access that service. But again, it's something that needs to be considered. We did have a population growth strategy, apparently. We had a deputy minister put in charge of it. It was obviously deemed important. And so, if we're going to have that conversation, this is one of the avenues that definitely has to be looked at. No doubt it has cost, but in many cases you can look at other jurisdictions to see what they are doing. I think there's definite benefits to it. I think it's a huge stress on a number of people. And I think it's an important topic, and one that's certainly not going to go away. Yeah,
and when people add to it the geographic separation that was part of this in vitro conversation, I don't know where the answers are there. And plus, if we lose some of the men and women who are hard working and determined enough to make the long commute to Saskatchewan or Fort McMurray, just wait until that has its negative effect on our rural communities where a lot of people are bringing home those big paychecks. I'm way over time, Andrew, but I appreciate your time this morning. Stay in touch whenever you feel like it.
I really appreciate you giving me all the time this morning, Patty. I hope you have a great day.
And the same to you.
Take care.
Bye-bye.